My name is Dr. Terry Cahill. I'm a family physician at United Hospital District Clinics. I've been practicing in Blue Earth for 24 years. I decided I wanted to be a physician when I was in 8th grade. So it was something that always intrigued me. My mother was a registered nurse, and I had an aunt who lived with us for a while who was also a nurse, and her husband had been a physician. It's fortunate that I've been able to take that 8th grade wish and turn it into a career here in Blue Earth. My area of practice includes pretty much everything family physicians see. I've been hospice medical director for 22 years as well, have an interest in taking care of children with attention deficit problems, and have been active in trying to help manage children's mental health issues. My professional goal since I've been in Blue Earth is to try and make sure we maintain access to rural health care and quality care in those areas that are underserved. We do a good job out in rural Minnesota, and we work hard to maintain those services, and UHD in particular has been very active in making sure we have high quality services and high quality providers. And I think sometimes the more we can personalize who we are and what we do really helps patient get at ease and trying to be as unintimidating as possible, and sometimes that's hard to do. So sometimes smiling and talking to kids and wearing a crazy tie sometimes gets people to relax enough to where they feel more comfortable chatting with you about what the problem is they're having. We try and make sure that we leave the menu open for the day and not lock ourselves into anything in particular. And I think that highlights the fact that we want to make sure we're dealing with what the patients have an interest in, and that we're there to help and try and make them feel better. UHD's statement is committed to care and committed to you, and I think that represents what we try and do here in Blue Earth, is to make sure that we focus on not just the patient, but being a service to our community. I think what really makes UHD clinics and hospital a special place to come is the fact that you're seeing local people providing excellent care. Sometimes we've known people since they were born, and helping understand what's making them sick sometimes has to do with how are they when they're well. And if you know somebody's going to run into you at Walmart or at the grocery store, you tend to want to make sure you're doing a good job. One of the big things healthcare is discussing these days is personal responsibility and people making sure that they keep themselves healthy. We'd like them to be responsible for their own health, and when they need a little help, we hope we're here and they use us as a resource to achieve that. My mission in working in Blue Earth is to make sure that we maintain access to rural health care in the state of Minnesota, as well as my personal goal of providing all the aspects of family medicine that I can, including obstetrics as well as critical care. I think it's important that we keep trying to strive to be better, and that's the other part of what I've tried to do in the time I've been in Blue Earth. I think one of the biggest strengths that I've discovered in my time here in Blue Earth has been being a patient advocate. We often have people who go to large centers and then come back to us and ask what we think. I think they appreciate that more than anything else. When it comes to insurance companies, when it comes to people questioning care, it's nice having someone who understands the different ways we get challenged in healthcare and providing care, whether it's a test that needs to be done, or a hospitalization that needs to occur, or a medication that we need to get approved. It's important that you have a strong advocate. I've told patients the most important thing when they leave the room is I hope they know that we care about what happens to them, and I think that's why I've been able to be successful in Blue Earth, is people know I care about what happens.